And as I said earlier in my introduction, she should have some interesting information about where we're going in terms of testing. Dr. Hamilton.
Good evening, everyone. Since the Ministry of Health started testing for COVID-19 in February, we have been insisting that the only test that we would utilize in Jamaica would be the PCR test, because it was the gold standard and at the time only reliable test. Well, we are pleased to announce today that based on guidance received from PAHO WHO on September 11, there is now another type of test that can be reliably used for COVID-19 diagnosis, and that is the COVID-19 Antigen test. So we promised that we would keep a watchful eye, and as soon as the technology was available, we would deliver. And so here we are today, announcing that effective October 2020, we will be introducing the COVID antigen test. Specifically, we'll be using a product made by SD Biosensor, the F200 test. Next slide. I just want to say, I know a lot of persons have been asking for alternative tests, but just quickly to say what the difference is between the PCR test that we used up till now and the antigen test that we're about to introduce. Both of these tests will detect current infection, and that is why both of them now have importance as we investigate our COVID-19 outbreak. The PCR test, however, detects the genetic material of the virus, whereas the antigen test detects proteins which the virus produces as it reproduces. So we are looking now in the antigen test at products made by the virus while it is multiplying. The specimen type remains basically the same. For the antigen test, we will utilize the nasopharyngeal swab only, whereas for the PCR test, we used a combination of nasopharyngeal and oropharyngeal swabs. Both of these tests give very good results. They have high specificity, so if they are positive, then we have confidence in the fact that this test can predict the positive cases. There is a difference in the sensitivity of the test, in that the antigen test is not as sensitive, which means that some of the cases that are negative could be false negative. But we will make allowance for that by repeating whatever tests we have that are negative on the PCR machine. The beauty of this test is that it is very simple and that it is very cost effective because the cost is low. But it will still require some specialized training, and it's also going to require daily reporting to the Ministry of Health. Good news too, this test is very well suited for public-private partnerships. Next. Now, the Ministry of Health and Wellness will, through PAHO WHO, procure a large number of these tests with the assistance of the Foreign Commonwealth Development Office and the United Nations. So PAHO will be collaborating with these two organizations, these two bodies, to procure for us an initial amount of tests of 80,000. And these tests are expected to arrive in the island in approximately 4 weeks. Now, we are not going to be, we are not going to be idle during the 4 weeks. I know everybody is raring to go. So what we are going to do is, in the 4-week period, while we are waiting, we are going to begin training, because with any new test, there has to be a certain amount of training. So we are going to begin